Hello, everybody. My topic of today is democratized healthcare delivery. I want to talk about why we need to do this. And a further lecture would be how to do this. And together they create future opportunities, global opportunities. So you can also say it's an introduction to healthcare innovation generation. How do we do this? Is it just merely a questioning process, or is there really a systematic process behind it? So I think that's almost a necessity these days. I'll start off talking a little bit about Corona and what the Corona effects are. I think we have seen quite a bit of deficiencies in the healthcare delivery system globally. So there is some differences between some of the developed world countries that believed had a good healthcare and now are actually caught with realities. On the other hand, we also need to see that there is traumatic inequalities. And if you really think about if this corona virus would hit areas in Central Africa, we would face traumatic problems, and I hope we have a cure by then. So a question that comes up in that context always is healthcare a human right? Or is it limited to the ones to get good healthcare that can afford it? I very much question that. And we also need to understand that, again, inequalities, the poorest, the weakest, emerging development nations possibly will suffer the most in these kind of events. And that's why we need to also think about whether future healthcare delivery needs to be a little different. It's not only deal with treating diseases in acute or an ambulatory care setup, but also prevents things from happening, which allows us to monitor things at home, or health at home. So rather than to treat a disease, we try to find out when something will happen and prevent massive actions from happening that are costly, that are limiting, and that are not accessible to everybody. So question that comes up in that context too is the current setup remaining? Will we see that in the future as well? Or will there be massive changes to the way we deal with health, the way we deliver health, the way we have business models? So we'll see on whether that has also an effect on device and workflow developments in the future. And again, I think we're all sure and certain that a Corona type effect will come again, likely in the future. And not everybody will be equally prepared. And I think we should do our utmost to make sure that everybody is prepared at least as good as possible. So the learning goals for this one are, for this little presentation are, to distinguish between incremental and disruptive innovations, to also understand that there is a need for disruption in healthcare, and what I mean by healthcare democratization, what kind of changes will come up, likely at least, and what are the future development trends and goals with respect to also biomedical engineering activities and university-based innovation activities. And I finally would like to talk about the need for healthcare innovation design skills that are not necessarily related to a depth part, so knowing how to do AI, but to understand applications and future-based applications to actually be able to use this technology most efficiently in the future. So I want to start with the health determinants, what is actually relevant for staying healthy, being healthy. And one of the most important one is the socioeconomic factors and social circumstances. What is your education? Are you suffering hunger? Do you have shelter? Have transportation availability? How well are you educated? They have a very significant impact. And if you look at some of the numbers between the top 10 and bottom 10%, there could be, significantly more than 10 years of life expectancy difference just based on these socioeconomic factors. Of course, there's some genetics and biology there, so you cannot choose your ancestors, but we're also working on those. And so I think that some of you may believe that genetic reading is possible already, but that genetic writing may also be possible, and that you may be able to address some of these genetic issues in the future. 35% are dependent on individual behaviors. So what do you drink, what do you eat, and whether you use drugs, smoke a lot, exercise a lot or not. And very obvious points. 10% are dependent on your physical environment, where do you live, and only 15% of your health determinants are related to the actual quality of the healthcare provision. So, but this is what we deal with. This is what we all put our money and efforts in there. And if you look at these, you may question yourself whether that is wisely spent and well spent money, particularly since some of these healthcare provision effects. So when you are getting sick, dependent on a lot of other things that you may want to address earlier and sooner anyway. So we have a lot of issues in the developed world. I think some of them are mentioned already, where diagnosing and treating the sick, but we're not really focusing a lot on prevention. We have high regulatory hurdles. It takes a long time before things are actually being introduced in the clinical workflow. And we may actually have to deal with not only the fact that we'll have a different way of delivering health, but also that there's different business model attached to that. And if you really check the opinion of, this is the opinion from CEOs of healthcare institutions, where they believe where healthcare will take place in the next 10 years, only 12% they believe will happen in a hospital or doctor's office, and the rest will be at home or anywhere else, anywhere you are. So you basically carry your monitoring devices with you. Now, this is a dramatic shift from where we are right now, and that will also have dramatic effects on ways we deliver health and also the associated business models. Now, this leads me to the incremental and disruptive idea. So incremental innovations are basically, that's what we do. We try to see what's not working so well, we try to improve quality, and we add a little bit, we make technology smaller, more accurate, faster. We change a little bit on the processes and workflows, but the focus is we always change a little bit. So we don't do massive changes. And that's actually, with respect to regulatory, with respect to training of the people, probably the way that people want things to happen. However, when you really look at what disruptive innovations could do, disruptive means you don't think about just minor changes, but you're actually trying to come up with a completely different process and workflow, completely different technologies. And with that, you dramatically or significantly reduce cost and performance. This is not something that the healthcare stakeholders, clinicians actually want at the moment. They want these slow processes. But if you really want to reduce cost dramatically, which is necessary, you need to think differently. And you need to think significantly more in how do you disrupt, completely change existing workflows. So another way of looking at it is on whether you can actually change something by a factor of 10 or more, rather than only by 10%. Dramatic changes, not just simply changes. If you change something dramatically, you have to rethink the entire process. You cannot continue the way you had done it before and just look at individual things. You need to dramatically change. So if you, and that comes along with the workflow and the way medicine is being performed. A lot of people think right now we need to, when we talk about digital technologies, digital health, to think about making analog things digital rather than taking advantage of a completely new ability information set that is available by using digital information. And so they rather would like to improve traditional medicine than come up with completely new one. And we have to see that these incremental innovations that we come up all the time have not really shown to dramatically increase availability and quality, but they have actually shown to increase the cost more than the quality improvements are. So what is in contrast to the developing world? It's interesting. I want to see this differentiation because I want to show that there is different needs in different areas. So if you look at the developing world, you have completely different needs. Cost is a major issue. All these things that we have here are not there. And with that, if you have a high cost, you have a low availability. Systems are too complex. There's not service engineers around that can fix it. They need to be robust, not transported around. Maybe other climatic conditions obviously need to be connected, and you need to have them in different. You need to have adapted products to different areas, and so it's much more need driven. And maybe a little less regulatory, which also has some benefits to a certain extent. And you need to think also in terms of what rural areas could benefit from that have nothing at the moment. So low cost is extremely important. This is what I mean by democratization, is making things available to everyone, not just to a minority, to a half minority that is able to actually afford it. So if you look at any globally, however, you'll see that there's different shifts. We want to move from the evidence-based system that we have to a more precision and personalized medicine. So everybody's treated based on his, her individual health status. We want to have a healthcare system that is oriented based on, does it provide value or not? And we want to also have a system that puts the patient in the center rather than the patient have to move around within the healthcare system. So a lot of things will most likely change. I put the ones, current ones on the left and the future ones on the right. The one I've mentioned several times already, treating sickness is when you're sick at the moment, to actually focusing on prevention in the future, and the other things that have been mentioned already. So these already show you quite a bit of innovation potentials. Now, the future will be probably covered by a quadruple aim. Some other people say only triple, because they forget that there should also be an improved clinician experience. But in general, you should try for, when you develop new devices, workflow processes, for better outcomes, obviously, dramatically reduce cost, and improved experiences, clinician as well as patient experiences. So this is the goal that we should set ourselves. And the question is on whether devices like that will actually fulfill that. I think that's really cool what we have here. This is Brigham and Women's Hospital in Boston. MRI on the left, PET-CT on the right, advanced therapy in the middle. But ask yourself, besides the fact that it's a great technology, the question, does it benefit everybody? And what does it cost? Will everybody have the same chance to be treated by that? I think the answer clearly comes to mind, and clearly comes to your mind, that it's no, it's not the case. So there's no blame for the big companies that develop that, because their business model is based on getting things, actually having expensive things, because expensive things have a big gross margin, and they will also be not necessarily be interested in changing things completely around from the way they are actually performing at the moment. So I don't think that the big companies are the ones that will come up with the disruptions. It will be entrepreneurs, small companies, that will actually be targeted with solving these global challenges. And they won't possibly actually talk about reverse and innovation, come up with ideas of filling the need in developing countries first, and then prove a point there. Then once the point is proven, it swaps back to the developed world. That's what we call reverse innovation. So big companies, however, have understood that there is a continuous line of data exchange, data generation, and continuous care, from actually over prevention, I mentioned that here too, to acquiring statuses, diagnosis, therapy, performance, and then follow-ups and reconvalescence, recovery process. All needs to be connected. And this connection, this data point connection, is a very important task in future developments. We need to make sure that data points are the same, that data is exchangeable, interchangeable, and can be used for evaluating and analysis of the health status. So we'll have also an empowered patient, a patient that carries a lot of devices. I also have one here in my arm that measures steps, this issue that helps my health in the long term. There's a lot of devices around, and even the FDA, the Food and Drug Administration in the United States, has understood that these devices need to be are an important part of future healthcare delivery, and they need to be treated differently with respect to regulatory effects. There's also a blog I follow, I can advise you to do that, from Bertrand Mesco. It's called The Medical Futurist, where we talk about all these devices and what the value of them is, also with relation to the clinical exchange. So what are the future trends and challenges? Well, first of all, we will have a transition point that is much later than today, a transition from a home self-care approach to a professional approach, because you will be able to do a lot more things at home using sensors, your cell phone or other mobile devices. And you will also have, there will also be obviously tendencies to provide support tools for the elderly care, for home care, and also what I mentioned, I hope will happen, that we develop actually dedicated systems for developing country and third world needs. So there will be a lot of exponential technologies employed. Exponential technologies are you know, that's what the word already says. They have an exponential curve, so they will reduce. They will create some form of abundance, cost abundance, and they will actually possibly also replace existing people, but they will have a huge effect on healthcare. AI, I think, is a clear one. Robotics, blockchain is making sure that data is safely transferred and maybe is recorded properly. So we will see these technologies employed in healthcare, and we'll hopefully see something from treating sick to preventing from becoming sick, and all the other things that I mentioned before. So, and we should, obviously, when we do developments, maybe rethink some of the value propositions that we use right now, complex, expensive, and replace that with cheap, easy to use. And I also do that. I look at existing workflow approaches. So how is it being done right now? And just look at whether we can actually reduce complexity and cost associated with that. So there's a lot of other opportunities. There are innovation opportunities. Who pays for the healthcare in the future? Is it government? Is it yourself? Is it a mix? Is it a business or not? What kind of business model will there be around? Also, how do we deal with the issue of not having enough medical staff? What is the issue with ethical concerns, regulatory, and many, many more. So we have a lot of international innovation opportunities, and I hope I will be capable of actually teaching some of this in a dedicated innovation generation lecture. Quick example from my own. I developed a auscultation device, a system where you actually listen to the sounds from the inside, and it's a very rudimentary system. But rather than making a process digital using a digital stethoscope, we completely changed that that setup, and now we evaluate the sounds based on autoregressive modeling schemes, welfare transformations, Fourier transformation, try to extract features that hopefully will help us to understand the process that is associated with flow better, and maybe use it for monitoring, home care monitoring, and other devices. So the idea is to actually connect it then to the clinician. It is very cheap, AI-based, fully connected, and once the setup works right, it can be used at home. So these are some of the techniques I will teach in this innovation class, where we start with the clinical problem, we identify it, subsequently ideate around it, and then find in an implementation method, also startup method. So these are some of the methodologies I cover, and I hope to see you in these classes. So as a summary, there's massive opportunities for people that think disruptive. I'm not saying that we should not continue doing incremental innovations, but thinking disruptive could dramatically change it. And we also should think about developing world activities, while we understand that there's a need to change things in the developed world as well. So please stop complaining about problems and start solving the problems. With that, just a quick note on my references, and thank you very much for listening.